Hello everyone, we're going to talk about menopause. So menopause is a regular function actually. It's part of a woman's life. They get it around their age 48 to 55 is the average year age for menopause. So what are the causes? Well, it's normal, we know that. It's not exactly fun to be a woman in this case. I heard, my mother told me. So high levels of pituitary, because it's going to, whenever you want to think about low levels happening in the body's going to compensate and basically release even more, but then nothing happens because there's nothing there to like, if that makes sense. So high levels of pituitary and low levels of ovarian hormones. That is basically what is causing all these symptoms in the body. It could also be caused by surgical intervention, like a hysterectomy, or chemotherapy and radiation could be other reasons that there'll be menopausal symptoms. But the more traditional route, what we're going to be talking about is those 48 to 55 years of age and what those women are going through. So the labs that we're going to be looking at is a drop in progesterone and estrogen. These are the hormones we're going to be looking at. There may still be an increase in FSH and LH because we're talking about the follicle stimulating hormone, and the luteinizing hormone is coming from the pituitary gland, and those may increase to compensate, but it's not working. So eventually they'll lower down, but initially they're going to raise. Our clinical manifestations that we're going to be looking at is no periods for 1 year. That is what determines menopause. The deal is so they're happening 48 to 55 years of age. We know that. Post-menopausal is after this 1 year time. So during this time, you don't really know how long this year is happening, but it's called climacteric perimenopausal. Once there's no more periods after a year, that's when you call it that you're at menopause, post-menopausal. So what are you going to see? There's going to be an inability to multitask, poor concentration, migraines, irregular periods, wake up during the night sweats, increased irritability, fatigue. Often women are urinating during the night, a loss of libido, vaginal dryness. We also want to talk about like the hot flashes. I have this picture that like says like the whole body. There's going to be weight gain, heavy night sweats, palpitations to the heart. The breast is going to enlargement, and there's going to be pain. There's going to be hot flashes in the skin. This is the experiences the patient may feel. So we were talking the breast enlargement, there's going to be pain, the heart's palpitations, the systemic is weight gain and heavy night sweats. Now the skin, hot flashes, dryness, itchy, thinning of the skin, and tingling. The joints may have soreness, stiffness, back pain, the urinary system, incontinence, urgency, so less control over the bladder. The psychological things to consider that you may see in a woman, so they kind of say like how menopausal women are cranky. Well, it's a little stereotyping because everybody's their own individual, but there are signs of dizziness, interrupted sleeping, so they're agitated because of it, because this pattern's hot flashes, they're waking up, they're getting annoyed, they're irritated, they wake up with less sleep. It's just insane. So they're just like agitated, and I mean any normal person's agitated when they don't get enough sleep, to be honest. Anxiety, poor memory, their anxiety about what's the changes with their body, poor memory, inability to concentrate, depressive moods, swings. They're just upset with their body changes. Like a lot of people just don't want to become old, you know? So it's important for a nurse to be able to help with their self-esteem. Depressive moods, irritability, mood swings, less interest in sexual activity. They're going to have that vaginal dryness. Transitional menstruations, there's going to be shorter or longer cycles. There may be bleeding between periods during this time. In the vagina, it's going to be dryness, and they may have painful intercourse, also known as dyspareunia. Okay, so those are the basic things that you're going to see. Some complications that you're going to see, the main ones that like I like to think about is the deterioration of the vision, the heart disease, the vaginal dryness, the poor bladder and bowel function. So you think, oops, I peed in my pants. You think of that. Poor muscle tone or loss of muscle, so not as toned, gaining weight, like women thought they complain like, ugh, gaining weight, you know, that's how they think. Osteoporosis is a note because of the lack of estrogen, which helps with calcium. as well as psychosocial, the sense of loss, decreased self-esteem, and depression. These patients may feel. They may feel less of a woman, things like that. So some of the interventions that we want to do is we want to encourage them to still to continue with a breast exam. This is when they're more at risk for cancers. A pap smear should be done periodically. Other things to think about is increase the air circulation in the room. Suggest them because of the hot flashes in the room. It's and avoid heavy bedding because they may be hot in the night. So keep a cool environment for these patients. If they're depressed, they may need like an antidepressant like SSRI, which is talked about in the depression video that I talked about. If they're having hot flashes, there is medications such as clonidine and gabapentin that can be used for these hot flashes. Gabapentin is a anticonvulsant. Exercise and increased sleep would be helpful, and decreased alcohol and caffeine would be great suggestions for these patients. And really, alcohol and caffeine is not good for anyone. Relaxation techniques get these patients to calm down, not feel so stressed. It would cause more problems. There's alternatives like bioidentical plants. Just be aware of them because you may have to ask the patient, are you on any other, are you taking anything other than the prescriptions, because they may be contraindicated. Sometimes things that people take at home can be contraindicated for medications. You never know. So just make sure everything they're on. Ask if they're on herbs or are they getting massages to help elevate the stress on their body. So these are just basics. I have like a whole list of notes that talks about the 2 estrogen options, and then the one is where the estrogen and progesterone is given together. So, but I'm going to talk about medications more depthly and read it off, honestly, because I need to know it, you need to know it, everyone needs to know it, and it's not easy stuff to remember. All right, so before we go into medications for the hormone replacement, estrogen and progesterone, I want to also mention that a premature ovarian insufficiency, well, that could be caused. But the main thing is also weight-bearing exercises, because estrogen was helping them retain the calcium in the bones, and calcium may be administered, and also bisphosphonates. Some things to know is bisphosphonates suppress the reabsorption of the calcium. Also, when you take biphosphonate, you have to sit up straight for 30 minutes, and that's really important to know that little detail about it. If they're taking that in collaboration to help maintain their bone mass, but also weight-bearing exercises should be advised as well. All right, so there is 3 different kinds that I'm going to be talking about. So there's conjugated estrogen. Also called Premarin. There's estradiol, Clymeria, which is known as Clymeria vivella transdermal. And there's conjugated estrogen with the methylhydroxyprogesterone acetate, which is basically saying estrogen and progesterone is together. And it's also called pre-prom and pre-phase. So I'm going to explain each one. So I'm just going to use the term conjugated estrogen, jaded estrogen, estradiol. Those 2 are the estrogen ones, and then there's the one with conjugated estrogen with the progesterone, which is medroxyprogesterone acetate. Okay, so then I'm going to read what's in the charts and what seems like very important to know. Okay, so conjugated estrogen is needed for so the reasons that it would be used and an indicator would be needed for adequate functioning of the female reproduction system. It affects the release of gonadotropin hormones, so pituitary gonadotropin hormones. It inhibits the ovulation, and it promotes adequate calcium use in the bone structure. So estrogen also helps with this. Treats symptoms of menopause, which is the one we're studying, inoperable breast cancer, prostatic breast cancer, and abnormal uterine bleeding, as well as primary ovarian failure, prevention of osteoporosis, and atrophic vaginitis. So these are just reasons that they would be indicated, but I like to focus on the reason for menopause in particular, and also because of the bone restoring, holding on to that bone. So they have to talk to the healthcare provider if they should be using estrogen or not, because it really depends on their contraindications and their health status altogether, because there are consequences. So some side effects of conjugated estrogen is headache, dizziness, hypertension, edema, nausea, weight gain, breakthrough bleeding, and changes in the menstrual flow. So it's kind of messing with things. So these are side effects. The adverse effects that we really want to watch for is thromboembolism. Conjugated estrogen can cause thromboembolism. And our precautions we want to watch for is precautions, I guess, is if hypertension, asthma, gallbladder disease, congestive heart failure, diabetes mellitus, bone disease, depression, migraine headaches, because it causes headaches, seizure disorders, renal hepatic disease, family history of cancer, breast or reproductive tract, history of smoking, dementia, obesity. So these are things that would be like precautions for using conjugated estrogen. So there's a lot of precautions for this. But the contraindications that to focus on would be, don't take this when you're pregnant, but it's for menopause, or breastfeeding, thromboembolic disorders. Why thromboembolic disorders? Because they cause clotting. Reproductive cancer. So if it's a reproductive cancer, that's when you wouldn't want to take it. Hypersensitivity to the drug, but we know that. An MI, stroke, and phlebitis, so inflammation to the vein. So administration for conjugated estrogen is basically just give that titrated dose, use lowest effective dose, give with food or milk to decrease the symptoms of the GI. The dosage route is just PO 0.3 to 1.25 milligrams a day for 3 weeks on and 1 week off, so you want to rotate. Some nursing considerations to think about is assess the blood pressure, the eyes and O's, the liver function, edema, and assess for intact uterus. Patient teaching. So the focus on the patient teaching is do not take if they're pregnant or breastfeeding, but they're going to be menopause. So avoid the sun. This is photosensitivity. Get a regular pelvic exam, but you should always get a regular pelvic exam. Report pain in the calves and the chest, and exam breast and report any lumps if there is. So there's also explaining how to do a breast exam. You want to look and put your arms up, see if anything's coming out. Go in circular motions and make sure you cover the whole breast when they say that. Estradiol is classification as a therapeutic hormone as well. It's also estrogen. It reduces the symptoms of menopause, prevents osteoporosis, and cancer treatment for breast and prostate. It's really interesting that it says prevents its cancer treatment, but then it also says contraindications, so I'm going to have to do more research on that. All right, so the side effects of estradiol is GI upset, nausea and vomiting, bloating, breast tenderness, headache, weight changes, depression, breast lumps, and vaginal bleeding. Just things to think about. It's a transdermal patch, this one. Climera would be 25 to 100 micrograms once weekly. Vivella, 25 to 100 micrograms twice weekly. So these are things to watch for. So it's a transdermal patch. It's unique and it's that way. For the patient teaching, when it comes to estradiol, it's applied to a clean, dry, intact skin on the abdomen, the trunk. So you make sure it's on the abdomen and trunk, and it shouldn't be in the breast area. Reapply if failure, same preferred can use new. You can use a new one. Rotate application site weekly. Okay, yearly exams, monthly self-breast exams, but the other one also said self-breast exams. Taper if discontinue, and supplements with calcium and vitamin D for this one. All right. So then the other one is taking estrogen and progesterone together. It's called conjugated estrogen and medroprogesterone acetate. So these are the other ones to talk about. And I feel like I should make another, I should focus on studying these more in-depthly in separate time. But if you want to leave comments below to talk about these and what you know, that would be great. All right, so basically conjugated estrogen and medroxyprogesterone, which is just saying estrogen and progesterone mix. It's the restoration of hormone balance. It's an FD category X, so I guess that doesn't mean any, I don't know. Mechanisms of action organs, metabolism, excretion use. So it's used to treat menopause or estrogen. Deficiencies also used to treat postmenopausal osteoporosis. Promotes growth and development of female sex organs and the maintenance of secondary sex characteristics in women. Crosses the placenta, enters the breast milk, metabolized by the liver. So you don't want to, you really want to monitor for that. So this one also gets the secondary sex characteristics. Common side effects would be a headache, a nausea, vomiting, weight changes, amenorrhea, breakthrough bleeding, dysmenorrhea, acne, oily skin, breasts, tenderness. Our contraindications, we always talk about this, thrombolytic disease, history of breast cancer, and may cause harm to the fetus. But you're not going to give this, don't give this when you're pregnant. Some incompatibility drug interactions with this is blood thinners. This is dangerous. That's really interesting, actually. Thyroid meds, insulins, or oral diabetics, rifampin, ketoconazole, seizure meds, antidepressants do not take while pregnant and breastfeeding. So really, really, really important to think about. And there's administration techniques for this one, and interventions on the labs needed. So monitor the INO weekly, also weekly weight, because your weight can be, you can be gaining weight. It may cause increased HDL and triglycerides, so it may cause that good one, but triglycerides. Also serum glucose, and monitor for the hepatic function. Also assess blood pressure and frequency and severity of vasomotor symptoms. And some of the patient teaching for this one that's like really unique is like you're supposed to avoid grapefruit when it comes to with the one with progesterone, and take this dose as soon as remembered. Discontinue suddenly can cause withdrawal, bleeding. Advise to eat solid foods if nausea is a problem. Tell patient to report signs and symptoms of fluid retention, thrombolytic disorders, depression, hepatic dysfunction, or abnormal vaginal bleeding. Use sunscreen and protective clothing. So as well as the first one. So they both said protect with sun. So that's really, really, really important. I'm going to go through my little notes that I had as well as theirs. So I just said like prevent uterine cancer combination would be used with a combination therapy. I'm not sure if that's correct. Estrogen is only more at risk. Estrogen only is more at risk for blood clotting and cancers and strokes, I guess, than using the one that's combined. But you only need estrogen if you have a hysterectomy. The one that's estradiol is the one that's transdermal patch. So interesting. The main thing is estrogen causes nausea, fluid retention, headache, and breast enlargement. Progesterone, increased appetite. So there's difference in estrogen and progesterone. Increased appetite, weight gain, irritability, depression, spotting, and breast tenderness. Report immediately if you see a sudden loss of vision, severe headache, chest pain, hemoptysis, pain in the calves, especially swelling and redness, numbness in the arms and leg and abdomen, pain, tenderness. Let me check the note and if it says that same thing. Yeah, pain in the calves. Oh, but it says that with the other one. That's so interesting. So I'm gonna have to figure this out, but we do know that these are the three focuses of our drugs is that estradiol. It's also conjugated uncontrolled hypertension, unexplained vaginal bleeding, impaired liver function, active thrombolytic disease, porphyria, and breast cancer. So these are things that's contraindicated for. So the main three that we're going to focus on, and I should probably do more research on, is estradiol and conjugated estrogen, which is just the estrogen by itself. Estradiol is estrogen, and the conjugated estrogen with the medroxy progesterone acetate. So those are the three things to use, and there's a lot of contraindications to think about, but the main one of the estrogen only is more at risk for blood clotting, cancer, and stroke. So that's the main takeaway. Good luck, happy studying, and that's it.